Before consulting a physician, low back pain can be managed by the patients themselves. If a patient has low back pain and it's acute, meaning less than 3 weeks, then they can get by with Motrin, physical therapy exercises with core strengthening, or they can just do lift restrictions and watch what they do. We advise patients to seek treatment whenever the pain is limiting their functional status, in that they can't walk or they can't sit or stand for a prolonged period of time. We also advise patients to seek medical attention if their pain is greater than 6 out of 10, because if that's the case, then we as physicians can prescribe medication or physical therapy appropriately. Medication can give long-term relief, and I would say injections typically give short relief. But the idea of doing the injection is to provide the patient with a short-term relief so that they can get through the physical therapy exercises that are required to help them get better. Brigham and Women's Hospital, we're able to offer patients the whole spectrum of pain modalities. These modalities include intrathecal pumps, where we put a hockey puck-sized device in their abdomen and infuse medication into their spinal fluid. So we can get by with a tiny amount of medication through the intrathecal pump when you compare that to oral regimens. Another interesting modality that we have at Brigham and Women's Hospital are spinal cord stimulators and peripheral nerve stimulators. What a spinal cord stimulator is an electrode that sits in the epidural space right behind the spinal cord. The idea of that is if we're able to generate impulses through those electrodes, we're able to confuse some of the nerves and decrease the amount of pain that patients feel.